great member of our team, Graham Davis, our communication director, died of colon cancer last night. Those of you who knew Graham, he has to be the kindest person I ever met. You come in a room and everybody would smile. And I married him and Rachel on November 2nd. They went on their honeymoon, came back, and he had stomach pains and found that it was a very aggressive form of colon cancer, and he fought it for 4 months without complaint. But I want Rachel and the Davis family to know how deeply he was loved and how much we're going to miss him. It just seems like we are going to be tested on one way after another right now. On the testing side, we kicked off the site today. It is going extremely well. The plan had been to test 100 people today and 300 tomorrow, and then ramp up to 400 to 500 a day next week. It has gone so well that we are going to 400 tomorrow, and there are a number of slots that have opened for tomorrow just in the last hour, as we've seen how smoothly things have gone. So again, you can't just drive up to the site. You need a doctor's script. It's starting to work out pretty smoothly. If you call your doctor's office and the doctor determines you have symptoms and you need a test, the doctor can email you or text you the script, and all you have to do is hold the smartphone up to the window when you pull up to show us the prescription, and we will get you back test results in about 3 or 4 days. But thank you to everybody who is out there working today. It has gone beautifully. I have not had the chance to spend the time out there the way I wanted to today, because we've been spending the day addressing the issues with the Detroit Police Department. Chief James Craig this morning tested positive for COVID-19. It's something that we knew was a possibility. He is very fit. He's got mild symptoms, and he is very much in charge in running this department. I think I've talked to him 10 times today, but he's not going to be back on site until he fully recovers. And so today, Chief Gregg designated Assistant Chief James White to run the day-to-day operations out of headquarters until his return. Chief White is the longest tenured assistant chief in the department, and he's been leading the efforts relative to the safety of the officers. We are going to continue to ramp up the protection of our police officers. It is right now our highest priority. We have 39 officers who have tested positive for COVID-19. We have 468 officers on quarantine. We got 35 back in the last day or so. We've got 119 in the process of being brought back, but this is a major focus of the operations of this department. It's not just Detroit. In the New York Police Department, they've got well over 300 officers who have tested positive for COVID-19, and 3 of their highest police officials have also tested positive. And this is the world that we live in now. Dr. Rob Dunn will talk about this at length, but the focus of medical directors with first responders is to protect them from being infected from the citizens they interact with. What we have learned in the last month across this country is that when it comes to police departments, we have to put just as much focus on preventing officers from infecting each other. And police stations and precincts tend not to be designed in a way to make social distance easy, and it's not really a part of the culture. And we are going to have to dramatically change the way that we are doing this. So Dr. Dunn is now in his 3rd week at the police department. He's done a great job over at Police and Fire because we realized this was a focus. I'm really pleased at the way we've rolled out the new symptom checking at the start of each shift, so that an officer is running a fever, they are not permitted to come on duty, and we are not finding officers showing up who are running fevers. And today, Dr. Dunn spent much of the day with Chief Craig, with Denise Fair, our health director, and with Assistant Chief White, and has a far more aggressive 5-point plan to protect the health of our officers. And with that, I will turn it over to Dr. Dunn as he outlines what our police officers will be seeing in the days ahead. Doctor?
Thank you. With increasing prevalence of the disease in our community, we all need to be doing the best we can to protect ourselves, both in the workplace and at home, and we to always remain vigilant. We're going to focus on 5 points that we're trying to do to protect the health and safety of our police officers and other first responders. Number 1, workplace monitoring. That involves temperature checking every single day, every single shift, to make sure that someone doesn't have a fever. Early on in any illness, and particularly in COVID-19, you could have a low-grade fever and not have a lot of symptoms. So we want to do careful temperature monitoring and recording on every shift, and we've been doing that now for the last 3 days. We have fortunately not found any elevated temperatures. In addition, we do a symptom screen asking about symptoms of illness so we can get a sense of what's going on and bring that home to every single person that we care when you're coming into the workplace and that we don't want anyone coming into the workplace who's sick. The next point is reviewing every exposure, looking at the risk that everyone has been placed in by getting an exposure, looking at how that happened, learning lessons so we can mitigate it, being sure that anyone who develops symptoms can be tested appropriately. We have worked with our partners who have been tremendous this week. This new testing setup that is now up and running will also add additional capacity, but we have had tremendous support from our occupational health provider, Henry Ford Health Systems, as well as from the Wayne State University Physicians Group and Dr. Levy, to make sure that our first responders get tested and that we get results promptly. The third point is strict social distancing and modifying the workspaces that all of our officers work in so that helps to prevent that incidental contact, and we're sure that all the surfaces that are touched are cleaned and that people are not exposing themselves to each other at work if there has been any illness in the workplace. The fourth point is deploying additional personal protective equipment. We have had these things available, but we are assuring the supply of masks and gloves for the officers so that they can use them and feel comfortable with their personal protection, both to protect themselves and to protect the public. And the final point is focusing on return to work. We have a lot of people who've been out on quarantine who are very anxious to get back to work. We want to make sure we have a safe process and a process that they are getting evaluated. Anyone who had a positive test, to be sure they now have a negative test and no symptoms. We're again working with our occupational medicine providers, who's been doing this for health systems throughout this outbreak as it develops, and making sure we get everyone back to work healthy and safely.
And when I talked to Chief Craig and he said, I want Assistant Chief White to run the day-to-day operations, a big part of his reasoning was that AC White has dealt with this issue. He's been on quarantine from exposure about 2 weeks ago, and he has been running much of our response from his house. He has tested negative and is healthy, but he has a deep understanding of the risks that the officers are facing every day. The system worked in protecting him, and he's going to make sure that everything humanly possible is going to be done to protect the men and women of this department. And with that, I'll turn it over to Assistant Chief White.
Thank you, Mr. Mayor. Let me begin by thanking Mayor Duggan, Chief Craig, and Dr. Dunn for their work and leadership during these very trying times. The Chief has assembled a great team, and I'm very appreciative of him having confidence in me. Let me take a moment to emphasize to our community, the men and women of the Detroit Police Department, that our Chief James Craig, is still in command of this department. I will assume the day-to-day operations of the department in consultation with the Chief. The Chief and I speak daily, and recently that's grown to hourly, and a few days ago it felt like it was every minute. But trust and believe that the Chief is committed and locked in and driving this department Certainly we want him to get rest and fight this new challenge that he has, but we're confident that he'll be able to do so. As the mayor indicated, the chief is very fit, focused on nutrition and exercise, and we're hopeful that this will that will assist in carrying him through this problem. The Detroit Police Department has been greatly impacted by the COVID-19 pandemic. Our department recently lost one of our captains, Captain Jonathan Parnell, to this virus, as well as one of our civilian call takers. Please keep their families in your prayers as we continue to fight this epidemic. I owe special thanks to many city departments and department heads, but I want to make sure that I mention a couple right now. The Chief Information Officer for the City of Detroit, Beth Niblock, her IT Director, Art Thompson, have been extremely instrumental in getting us into our emergency 911 backup system and a number of other things throughout the department that have aided our officers. I want to get into the 5-point plan that the doctor has just talked about and really unpack for you how that's going to impact our department. First, there's the temperature monitoring with the officers at the precincts. Each member reporting for work, entering a facility, is having his or her temperature checked. In addition, each member, after completing a questionnaire about their overall feeling on the day, if they're feeling congested, tired, if they're experiencing any other symptoms, we record that information, we take their temperature, and then there's a prompt assessment and follow-up in the event where there's any abnormalities reported or discovered, such as a fever accompanied by a dry cough. A supervisor will notify our department's COVID task force. That task force then will, in consultation with the doctor, Dr. Dunn, do an assessment of the member and direct them either into quarantine or the next steps in the process. As we move forward with this, it's imperative that strict enforcement of distancing in police facilities occur. All members have received instructions on maintaining a social distance no less than 6 feet. Furthermore, no more than 2 members are permitted to ride in an elevator at any time. Hugging is also prohibited. We've deployed a number of masks throughout our commands. The department will continue to do that. We are encouraging members to wear the mask to help prevent the spread of germs. This, along with other issues with the masks and social distancing, will go far in keeping our members safe. We are also working with Dr. Dunn on our strict return to work plan. A number of personnel, as Dr. Dunn has indicated, have been tasked with tracking the status of every member, also reaching out to the members to see how they're doing throughout this process. As we talked about earlier, we have a number of members throughout the department that are quarantined, and we've been reaching out to them just to see how they feel. And we found a number of different things that have come up with that. They need some resources, they need access to some healthcare facilities, and we've been able to do that. That's been very well received. Once we implement the strict return to work plan, working with Dr. Dunn, we look forward to getting those men and women back to work. And as Dr. Dunn indicated, many of them are anxious to get back to work and ready to go and serve our community. As this situation continues to develop, the Detroit Police Department is going to keep working with Dr. Dunn to ensure that our practical application of this 5-point plan is instituted in the most effective manner. We've already begun to take steps to redeploy personnel, looking at our entities that play a crucial role with policing, but not necessarily responding to police runs. We've moved some of those personnel around, and it's our hopes that once we are past this circumstance, that we'll be able to return those members to the department and to their original position. As the mayor indicated, I myself am recently returning to work from being quarantined. The process worked for me. I was quarantined, I got my test results, and I was able to return to work. And I'm committed to ensure that every member of this department is safe, that every member of this department gets an opportunity to avail themselves to the resources that we have with testing and to get them back to work. But more importantly, to get them back to work safely. So with that, I'll take any questions.
All right, anybody have any questions? Yes. I have not been tested. You can't get tested if you don't have symptoms, and I don't have symptoms. But at the first sign of symptoms, my friend Dr. Dunn will certainly write a script and I have made it a point to stay 6 feet away from virtually everybody, including Chief Craig. I drove briefly past it. I would have loved to have been able to stay and watch, but we were dealing with Dr. Dunn and the plan for the officers. Looked very smooth when I went past it. I'm told that things went so quickly that the plan to ramp up from 100 to 300, we didn't need to, so we're going to a full schedule tomorrow. Could not have been better. We got a question about what materials we need, but if there's anybody out there who can get us access, particularly to swabs, as crazy as this sounds, our biggest single need for our testing center is swabs to be able to do the tests, as well as the N95 masks in particular. But it's going well. The 3 hospital systems are doing absolutely great, and I will be out there tomorrow to see it myself. You know, the reality is every one of us has interacted with somebody who has COVID-19. That's southeastern Michigan. And that is the reality. And I will keep saying the same thing over and over. This virus wants to jump to a new host. And it can jump to a new host off of surfaces, but the great majority of the spreading is occurring in person-to-person contact. And I think we're all getting to the point where we all know people who have tested positive. But I will let Dr. Dunn talk about what more we possibly can be doing beyond what we're doing.
Well, I think one thing to really say is we really need to do what is being recommended. I think we've all probably maybe been out places when we are doing our essential services and maybe seeing people who aren't using very good social distancing. And I think we all maybe cringe a little bit about that. People have heard about parties and other things that maybe aren't the best use of social distancing. So I think we really need to realize that the old-fashioned things are the most important. Social distancing, very good hand washing, right? A lot of us were getting a little slack in our hand washing over the years. This is the time to really focus on that. And then cleaning surfaces. Don't sit down and, if you're using a computer or something like that, make sure you wipe it down. Cell phones, make sure you're cleaning your cell phone because you never know when something may get contaminated, particularly if you're coming to a new surface. So I think those are the things to really, really focus on. And I know it's a difficult time, but it's the most important thing we can do.
So the question from WWJ is, how does the testing process works? So you call your doctor. If your doctor determines you meet the standard for a test and writes you a script, you drive up, you call our number, and they will book you at a time, 9 to 10 Saturday. You drive up, you show them your driver's license that you are the person you say. You show them the script, either the hard copy or on your smartphone, and they will wave you to the front of the line. They will take a nose and mouth swab with a Q-tip, and you'll be on your way. And in 3 or 4 days, you'll get a result. That's the way the process works. I got a question here from Channel 7 about the potential siting of large scale places if we have surge needs in the hospital, and we are working with General Rogers in the state of Michigan to evaluate all of those sites. The state will ultimately make those calls, but I am making available for the list every single site that we have. And then the other questions we got are communications with the White House and the governor, and it's every day. I reached out to our congressional delegation and to the White House today, and really this is the hardest thing we have to find right now, are swabs to do these tests. I'd like to be doing 1,000 tests a day at that site, and what we will run out of first are the swabs to do the tests. This country is so limited in our testing capacity. But what you're going to see is this, and people will call Detroit a hotspot, because we're now doing this testing site, the number of positive COVID-19 cases in Detroit is going to climb very fast. It's not because we have more than other areas, it's because we're testing better. And really, the national statistics are all about who's doing the best at testing. And so I hope the media, when our numbers start to climb next week and the week after, when they start to climb very rapidly, will recognize that that's because we have finally started to do testing in a significant way. Anybody have any other questions? Yes. No. So he's not been hospitalized, and talked to him today, and he said, this is what I signed up for when I went into law enforcement. I knew the risks. I got a great team, and I'm going to run this place from my home until I beat it, and I'm back. And so Henry Ford has been really good about, as we mentioned the other day, I think right last year, we set aside 20 slots a day for testing of Detroit first responders. Chief Craig, I insisted, took the first slot because I had my sense. And so Henry Ford has just been a phenomenal partner on this, and we deeply appreciate what they're doing. So the question is, are we looking at outside agencies? As of yesterday, again, the Detroit Police Department is making its 911 response time. I just continue to be amazed at the officers who are working the extra shifts and are showing up. And, of course, the department has converted a number of people out to patrol. We have contingency plans for everything, but at this point, there's no plans to ask for other agencies. We're taking this at a day at a time, and I think Assistant Chief White can elaborate on what he's done to make sure the patrols have been out there.
Yeah, as the mayor indicated, we have contingency plans in place. We haven't activated the patrol contingency plan yet. We did return a number of officers to patrol from assignments that were not patrol related. But at this point, we have not had a need to reach out to other agencies for support. And as the mayor also indicated, the officers are making the runs. Our response time is still strong. I've never been prouder to be a member of this department when you look at what the men and women out there are doing on a day in and day out basis. So right now, we're good.
So we study the New York patterns very closely, and the crime and the calls for service have dropped 20-25% in New York in the last few weeks, which has allowed the NYPD to keep up with us. We're seeing early signs that that's happening here as well, and that has been assisting us, and I hope the people of the city will continue to cooperate in sheltering in place because it is allowing the police department to continue to respond to the critical calls. And I think yesterday was 10.5 minutes. I mean, the national standard is 12 minutes. So it continues to be remarkable what DPD is doing. I hope not, and I've had people very close to me in contact with the White House today, and we have been absolutely assured that nothing is being done to hurt the state of Michigan because of politics. And so I hope that's not the case, and I know the governor is working to make sure that that's not the case. Anything else? Thank you all very much.